Thank you.
Dr. Preston, maybe I can start with you. We're seeing a lot of resistance, riots in the street in some cases as a result of these lockdowns. Do you think they're the right thing, the right approach in terms of dealing with the fact that there are so many unvaccinated people? Austria as well has implemented mandatory vaccines. What do you think of all of this?
It depends what the motivation is to do it. Clearly, many countries have used lockdowns in order to try and give their health services some breathing space to deal with the influx of COVID patients. And I think that seems to be, what else can they do if they're worried about their health service grinding to a complete halt or collapsing? But the pressure that they're putting on the unvaccinated, we in this country, which is certainly the approach I prefer, is that vaccine is of course voluntary, and it's really up to people like myself and others to put forward the case for vaccination and try and show that it's obviously has huge protective effect, and to meet the concerns that those people who are uncertain about vaccines, to meet those head on and give them open and honest advice so that they can come to their own decision.
Yeah, I agree with you. You've got to persuade people. I'm a big fan of the vaccine. I've got it myself and had my booster as well last week. But I mean, you've got to persuade people, don't you? You shouldn't force people to do anything for their bodies, really, I think, anyway.
I mean, it is an argument you can argue both ways, because, of course, this is an element of public health. So it's not just about the health of the individual and the choice that they have. There are certain things where there are consequences for other people around you. If you walk into a place with an infectious, communicable disease that can be passed on just through the sheer act of breathing. So, you do have to take maybe a wider view. But overall, I still think that the case for vaccination is so strong. If we fail to make that case, then that is work for people like myself to do. And we're setting a legacy here for future pandemics. It's almost certain that we will have maybe not exactly the same situation, but be facing the same dilemma in the future. Yeah, so what we do now lays a legacy for how we respond and the public willingness to take sort of establishment advice in the future. So we need to be very careful about the approaches used now.
I want to bring in Professor Karol Sikora just in a second, but just to be clear, Dr. Preston, you do think that these lockdowns in Europe are justified as a measure that need to be taken because of the situation there. Is that correct, or is that quite your view?
Lockdowns work in bringing down the transmission of the virus, but they're only effective if you use that time during the lockdown to put in place or to change the situation. I think we've seen quite clearly that if you just lock down and hope the virus goes away, it doesn't. And then as soon as you unlock, which of course you do have to do, no one could afford to lock down for long periods of time. It has other terrible consequences. Then as soon as you do unlock, the virus returns with a vengeance. So it's about what are you going to do with the time during the lockdown? And maybe places like Austria have chosen, they say, well, we need to lock down in order to increase the levels of vaccination amongst the population. Of course, then the decision comes, well, how do you encourage more people to take the vaccine during that period of lockdown?
Professor Karol Sikora, you've been waiting patiently. Thank you so much for joining us this morning. What do you think of what you've heard, and what do you think of these scenes that you've seen across Europe, in Austria, the Netherlands, Croatia, Italy, Germany on the brink, Angela Merkel thinking of another lockdown? What do you make of all this yourself?
It's all very unexpected. I really agree with what's been said. Lockdowns are a tool to use as a tool of last resort, and vaccination is a much more effective way of doing it. The real problem with Austria now, and I think they're going through breaking new ground, making vaccination compulsory. It's not been thought through. It's clear it's not been thought through.
There are actually 4 countries in the world. I was astonished to read this morning. There are 4 countries in the world, including my favourite, the Federated States of Micronesia. Yes, that is a real country, which has mandated people to have the vaccines. But this, I mean, I absolutely, I mean...
How do you do it, though?
Well, exactly. You got to hold people down and inject them.
Right.
I certainly hope not. I mean, I am as big a proponent of the vaccine. I have no medical training whatsoever, but I know what I read, I know what I see, I know that it works, and I am the biggest proponent, and I will not stop banging on this program every week about how the vaccine is a good thing. However, locking down, I'm just not sure, Professor Karol Sikora. You say it's something of last resort, but I mean the resistance there are lots of people who are very, very annoyed about this. A lot of instability.
I know. And vaccines the key. And if you look at it, Austria, surprisingly, I looked up the figures this this morning, 68% of people have had at least one shot. In Britain, it's only 74%. So it's not that different. Would it happen here? What we haven't heard from the Austrian government is what are the consequences of not having the vaccine. In other words, can you drag little old ladies out of the house into a police station and get a police doctor to come and jab them? Now, I think that would be completely repugnant, and I don't think they mean to do that. But who knows what's going to happen? It's not.
And I think you got a very good point, Professor Sikora. Maybe we can ask Dr. Preston as well, because I mean, presumably, if you've got mandatory vaccines, as Karol Sikora says, what are you going to do? And also, the people who are the hardest to reach, the people who are really resistant and really, have made what they would say is an informed choice. They've read the things and they've decided the vaccine is not for them. I mean, they're going to be even harder to reach. Presumably, there's a sort of soft resistance. There are people who will essentially say, well, I don't think I want it. But then if you mandatorily have vaccines and you have these lockdowns, you have these very draconian measures, surely that's going to impose a system that a lot of people will resist yet further, Dr. Preston.
No, absolutely. I think most people, if you're the parent of two teenagers, you quickly understand there's certain people don't like being told what to do, and certainly a much more effective approach is to bring them along with you and try and make them come to the decision that you think is the best one. So yeah, I think I think there are certain people that maybe are just uncertain about the vaccines. Those are the ones that I think that can be reached, and again, it's really important they come to a decision that they're happy with. They've got to live with the decision they make in years to come. And again, we're probably going to be facing a situation where we'll be asking them to take future vaccines, and it's going to be so much more easy if they have been persuaded and come to their own decision. But there are going to be a relatively small number that are ideologically opposed to vaccines who are never going to be reached, and this is just really going to, I think, give fuel to their fire.
That's it. I think that's a really good point. Professor Sikora, here in Britain, of course, Boris Johnson has talked about the storm clouds gathering over Europe and perhaps a little bit of contagion and all of that. Do you worry that here in Britain we'll see some sort of lockdown or even just sort of plan B measures maybe towards Christmas or something like that, or do you think we're out of the woods?
I think we're probably out of the woods. The number of people going into hospital each day has been stable. It's less than 900 at the moment. And so that's the key figure, whether the NHS gets overloaded and people with other diseases, such as cancer, my specialty, suffer as a consequence of it. So at 800 a day, average stay 8 days, the system can actually cope with it, and you don't have to stop doing things. It's less than 10% of all the overall capacity of the NHS. But if it went up, then something would have to be done. And that's what the number every day that the health minister is looking at is exactly that, the number of people going to hospital. But going back to the vaccination, what's the reason that people object? You're quite right, Peter. There are a lot of nutters out there that think they're injecting chips that are going to follow you around the world afterwards, as though we really care.
I mean, if that were the case, I'd be happy to have better 5G. I don't know about you. I mean, my Wi-Fi's terrible.
Exactly. So that's one thing. But the serious reason why most people object is they're worried about side effects. And, it's a good reason. The AstraZeneca vaccine has killed 73 people in this country. That's the current published data on it. The Pfizer, less deaths, but more myocarditis, the inflammation of the heart. People are worried. And these vaccines have not been around that long. They only came. In December of 2020 when they first came. And like you, I felt incredibly privileged to have the vaccine.
Yeah, me too.
Absolutely. And, the problem is, can we persuade people? I think that's the problem for all health professionals. Yeah. How you persuade people, the rational decision is to have the vaccine, the booster, everything.
Just a final word then to Dr. Andrew Preston. What do you make of what you've heard this morning?
Yeah, I mean, we've been sort of discussing it and talking about how do you make a successful case for vaccination. There is clearly still work to do. I think also another element of that is really trying to get to grips with the blatant disinformation. People should be allowed to raise objections and to ask questions and to raise concerns. But some of the more ludicrous, but very kind of infiltrating ideas that this is all some sort of conspiracy and the false information about vaccines that is costing people lives, and I think we can still do more actually to eliminate that and to bring people to account for spreading things which they know is completely baseless.
Completely agree with you. Dr. Andrew Preston and Professor Karol Sikora, thank you so much for joining me this Sunday morning. Great to hear from you both. A lot of